Well, hello everyone, and thank you for joining this webinar from wherever in the world you are. This is a webinar on the impact of COVID-19 on women in transport, and it's hosted jointly by the UK-aided or the UK-aid-funded High Volume Transport Applied Research Programme, HVT, and the World Road Association, PIARC. My name is Jeff Turner. I'm a technical advisor to the HVT programme, and I'm a specialist in transport inclusion and gender equity, and I will chair today's webinar. And it's a real privilege to do that because I think this webinar could make a significant contribution amidst all of the webinars on transport and COVID that are being organised and that many of you will have already participated in. That's because this webinar reinforces the need to recognise that whilst countries across the world are, there's a commonality in experience of the economic and the social upheaval and the upheaval to the transport system, and there is a commonality in many of the policy measures being put in place around COVID-19. There are differences in terms of the experience of the impact. There's differences between low-income and high-income countries, and there's differences of the experience of the impact of COVID-19 policies between men and women. And there's a need to recognise that, understand that, and respond to that in going forward. We already know a number of the differences that we expect. We already know that women make up a greater proportion of key workforces like the health sector, also in many low-income countries in the urban food supply sector in terms of buying and selling food. The burden of feeding households and meeting the health needs of the family, it falls frequently disproportionately on women. Women face disproportionate levels of sexual harassment and personal insecurity when mobile, when travelling out of the home. And in the transport sector itself, women are significantly underrepresented and may be more likely to face precarious and vulnerable employment situations. So given all of that, what are the impacts on mobility, women's mobility, of stay-at-home policies, of restricted public transport availability, physical distancing, and how does that impact? And what are the economic consequences of many of these measures for women who work in the sector? And finally, this webinar can be part of a call for action for greater understanding of those gender differences and for the incorporation in any post-COVID-19 recovery that the transport sector makes, so that that recovery includes men and women equitably in both its development and its implementation, and delivers a gender equitable and inclusive transport sector. So I'm really pleased to say that this webinar will draw on a rich set of experiences and expertise and ongoing research from an expert panel of experts from around the world, and will draw together insights to help us understand and appreciate the gender differences of the impact of COVID-19 and plot us a way forward. I'm really encouraged to see just we have over 400 people registered for this. That means we're going to enforce some housekeeping measures. We are recording this webinar. All attendees are muted except for the presenters. All our cameras are off, so please keep them off and your mics muted. Please type your questions into the chat box so that they can be addressed during the question and answer session, and keep those questions brief if you can. And please include your name, your organisation, and which presenter you're directing the question at. The webinar will last for 90 minutes, and we'll do our best. I'll do my best as chair to try and keep us all on time and track, unless the conversation gets really, really interesting. And a copy of the slides and recording will be published next week. So I've probably already broken my time limit, and I'll pass now over to Louise Cathro, who is the programme manager for the High Volume Transport Programme and a consultant in IMC, a worldwide consultant who manage it, to introduce the programme. Louise.
Thank you, Jeff, and thanks everyone for joining us online today. My name is Louise Cathro. I'm the Programme Manager for the High Volume Transport Programme, also referred to as HVT. HVT is a 5-year applied research programme which is funded by the UK Department for International Development, or DFID, and this is focused on national and regional transport corridors and within cities in low-income countries. The aim of the HVT programme is to increase access to transport services, making transport more affordable and accessible, more inclusive, safer and greener. Our beneficiaries are the governments and people in low-income countries in Africa and South Asia. HVT commissions research and draws on relevant case studies, other research, and lessons from other countries, including those that have made the transition from low to middle-income country status. Gender and social inclusion are a key priority research area for the HVT program. And over the past year, we've supported DFID's efforts in this area through a number of initiatives. We've carried out a comprehensive state of knowledge review of gender and transport in developing economies. We've published a policy guide on disability inclusive transport, a document that was intended for policymakers, and arranged the foresight session on this topic that was presented at the PIARC World Road Congress last year. We've also called for proposals for research suppliers to provide us with innovative research projects that can improve transport systems for women and other vulnerable people in the global south. All these documents and links to our social media are available on our website. And we also have several other ongoing initiatives that ensures that inclusion is integral to all the work that we do. As the COVID-19 pandemic moves into low-income countries, and with transport systems being a primary mode of infection transmission, we need to understand the impact on women, not just as transport users, but also as workers in the sector. What are the issues facing women? Who is addressing these issues now and post-COVID-19? Last week, the HVT program published a paper calling for coordinated action on COVID-19 by key stakeholders in the global transport sector. This publication is based on the findings of work we've been doing over the past few weeks to establish who is doing what in the transport sector in response to the pandemic. I hope that you enjoyed this webinar today. We are really interested to hear the perspectives from our speakers and also the thoughts from our audience as we seek to capture the ideas, the gaps, or the initiatives that could benefit our low-income beneficiaries and spark off new research under the HVT program.
Thank you very much, Louise. So I'd like to now call on our next, they're going to be a joint presentation on our next two speakers, Christos Xenophontos, who's the Assistant Director for the Rhode Island Department of Transportation and is a transport engineer of over 30 years experience, and he's currently the Chair of the World Road Association's Technical Committee 1.1 on the performance of transport administrations, and Anna Wildt-Persson is a Deputy Executive Director at the Swedish Transport Administration. She works in the areas of long-term infrastructure planning, urban and regional planning, and she represents Sweden in the PIARC Technical Committee 1.1, as mentioned earlier, and she's also the co-lead within that on the Working Group on Staff and Human Resources, and they're going to share the presentation between them, the two of them. So Christos, if you can start, please.
Thank you, Jeff, and thank you, Louise, for the invitation to present during today's webinar on the impact of COVID-19 on women in transport. It is always great to see two partner organizations working together to advance some of the very serious issues in transport today. And I hope that this is something that can continue beyond COVID-19, because this is an area that has really been needed to be addressed for some time now. Next, please. Today, we'll give you a brief introduction to PIARC, share with you the efforts of the organization to provide support and valuable information to its members during the COVID-19 pandemic, which I hope you will also find useful, and provide you with an overview, most importantly, of the work plan and approach of Work Group 3 of our technical committee that will be concentrating on the organization of staff and human resources for transport administrations. Next, please. First, what is PIARC? Next, please. PIARC is the new name of the World Road Association, which was founded as a non-profit, non-political association in 1909. The goal of PIARC is to facilitate and organize the exchange of knowledge and ideas on all matters related to roads and road transport. Next, please. In the interest of time, I will not go into PIARC's 4 key missions in detail, but I do want to highlight that the work of the association is being conducted by members like Anna and myself, who represent PIARC member countries and organizations. All of us are volunteer members and dedicate our knowledge and expertise in an effort to advance the state of the practice in our respective fields and improve our organizations through knowledge sharing. Next, please. With COVID-19 and its impacts expected to have not only short but medium to long-term implications for the road and transport sector, PIARC looked to quickly understand the issues faced by road and transport administrations, including road operators, and to provide its members with relevant information as quickly as possible. Next, please. In order to achieve that, PIARC assembled a diverse group of members under the PIARC COVID-19 response team. The major objective of these teams that you see here is the rapid sharing of knowledge and practices between PIARC members on the impacts of and responses to the pandemic and the associated economic and social crisis. Next, please. The key focus of the response team was on the short term. We simply looked at how quickly we could provide relevant information. While such knowledge and current practice are not yet confirmed as valid or effective, and what works in some parts of the world may not be relevant elsewhere, inspiration can be found anywhere, and a good idea now could save lives, improve business resilience, and could minimize disruption of services. The response team identified as the best method for getting information out quickly the organization of webinars and the publication of short notes summarizing the information shared. Next, please. In preparing for the webinars, the team first looked to identify the key issues and emerging trends for COVID-19 across the road sector and PIARC members, with the following 6 categories being evident. Rather than going into them in detail, I would like to direct you to the PIARC website where you can actually find more information on them. Next, please. Since the middle of March, when the response teams was first established, it has produced what is shown here. More importantly, it has organized a number of webinars to rapidly disseminate information. As of today, we have organized a total of 13 international webinars, not including this one, 8 in English, 3 in Spanish, and 2 in French, with more webinars to come. We have also published a bulletin out of our March webinars that presents some first conclusions about the multiple and complex impacts of the COVID-19 pandemic on road and transport administrations. A second note that covers the April webinars is expected to be going out next week, together with an article in the Routes and Roads magazine in June. Next, please. As the crisis is continuing, we're also continuing our efforts. We plan to continue organizing webinars in all 3 languages. And to make them more valuable, we are collecting information to plan for future offerings. So if you could please take a moment and respond to the 2 polls that we have open with the links that we are providing here, it would be greatly appreciated. Next, please. Because during the current situation, time is of the essence, we decided early on that sharing of knowledge was important, even if it meant that it has not undergone the rigorous examination that we are used to when working on PIARC committees. I therefore wanted to share this disclaimer with you. Next, please. To bring all of this home and to introduce Anna, I want to share some of the demographics of our webinar attendees with you. As you can see, in the 10 webinars that are summarized here to the end of April, we had over 400 participants with almost 200 individual participations. Of these, only about 25% were female. Importantly, only 4 out of 50 presenters were female. This is why we believe that this seminar is so important to participate in, not only because the impact of COVID-19 is undeniably more severe on women, minorities, and vulnerable population, but because we know that even after COVID-19, we still have ways to go. We hope that the work that TC11 will be undertaking during this cycle will help identify some of the key issues and best practices and begin righting the situation. Next, please. On behalf of the PIARC COVID-19 response team, thank you for allowing us the opportunity to share with you, and I will now turn it over to Anna.
Thank you, Christos, and thank you for being invited to this webinar on this important subject. I'm a co-working group leader of Working Group 3 in the technical committee, where Christos is the chair. And the key points of my presentation today is to present the objectives and the issues of the Working Group 3 during our working cycle, starting this year in 2020 and finishing in 2023. And we are really beginning our work now. So we are starting our working group at the PIARC kickoff meeting in Paris this spring, and we are now in a phase to specify our work program and in more detail plan our work for this cycle. But I will also talk about Sweden's gender equality policies and what it means for us, to the transport sector. I will give one example of strategies we use in the Swedish Transport Administration, where I come from, and I will relate gender equality to the situation in Sweden and in the Swedish transport system right now with COVID-19. And lastly, I will ask for your help in defining the key issues for us in Working Group 3. Next, please. Firstly, our technical committee, Performance of Transport Administrations in PIARC. We consist of 3 working groups, and you see Working Group 3 deals with organization of staff and human resource. We have also Working Group 1, understanding how road and transport administrations measures the efficiency and effectiveness of customer experience and public value creation, and Working Group 2, who deals with the role of transport administrations in disruptive technology and service models. But let's go back to Working Group 3 then. Next, please. Our objectives of this working group is to really find and to share effective approaches in transport administrations to define and to promote diversity and equity, and to recruit and retain new talent in transport administration. So we have a wider perspective than gender equality, but gender is very important. It's a very important aspect. It's very relevant for transport administrations and for the whole transport sector, facing challenges in recruiting and retaining the right competence. And we know that the transport sector is very male dominated. Next, please. This is from our World Road Congress in 2019 in Abu Dhabi that PIARC organized. I wanted to share with you a picture of the foresight session on gender and transport that we held in Abu Dhabi. So PIARC has recognized gender equality as an important issue, and we had this foresight session together with the World Bank and IRF last autumn. Next, please. So the Working Group 3 will investigate how transport administrations define key competence and how they recruit and retain them. We will define challenges regarding skill supply in transport administrations, lack of equality, lack of equity, diversity, deficiencies in the education system, etc. And we will also investigate how the administrations promote diversity and equity with effective approaches and strategies. Next, please. And this is just a slide showing what methods and deliverables are expected from our working group. We are planning roundtable discussions. We are planning on a survey this year and a report in 2022. Next, please. So one example from Sweden, our starting point is Sweden's gender equality policy, and this is a way to translate it into the transport sector. And I think now you have to click some, yes, okay, thank you. 2 more clicks, please. Thank you. The Sweden's gender equality policy consists of 4 policy goals: equal division of power and influence, economic equality and equal education, equal distribution of unpaid housework and provision of care, and men's violence against women must stop. And you can easily see that this translates into the transport sector in different ways. The first point, equal division of power and influence. Of course, it means equal opportunities to influence decision-making in transport planning and implementation. When you look at economic equality and equal education, you might talk about equal opportunities to study options and paid work, giving, economic independence. When it comes to equal distribution of unpaid housework and provision of care, of course, mobility is a very important issue here. to contribute to equal opportunities to travel to work, to study and healthcare. And men's violence against women must stop. Of course, you are hoping to find and to create a safe and secure transport system. Next, please. This is just an example of a strategy that we in the Swedish Transport Administration use to promote equality or equity, gender equity. We work with KPIs to measure and to follow up on gender equality among our staff in different positions and different management or steering groups. So it connects to the policy on equal division of power and influence, and also to policy on economic equality. Next, please. So to relate to the policies on gender equality in the Swedish transport system, we see some examples of short-term impacts of COVID-19 in Sweden right now, and I'm sure that you recognize many of those with regard to gender and women in the workforce. We see sharply reduced demand for passenger transport. We see traffic growth temporarily halted. We see heavy impact on public transport in cities, on passenger traffic by rail, private car, taxi, bus. And we know that that women are more likely to use public transport, for example. We see large short-term impacts on travel patterns, commuting, buses, business trips, business missions, leisure travel, other trips as well are affected. Bus, public transport, passenger traffic by sea and air. We see increased work from home, teleworking for office professions in the service sector. Of course, impact on commuting. We also see this is primarily a factor for cities and regional centers, because that is where the professions in the service sector mainly exist. We see sharply increased unemployment in some sectors, despite the stimulus measures that are provided. And we see also signs of slower innovation rate due to cut-in budgets for research and innovation, layoff of labor, etc. So it's going to be very interesting and challenging to see what the impacts are on the long term and what are the lasting effects of this regarding gender and women especially. Next, please. So this is my question to you, getting some impact on PIARC Working Group 3 on organizations of staff and human resource on gender and COVID-19. I just specified some questions or topics to address, and I think there might be many more. For example, how are women as employees in the transport sector and then in the transport administrations affected, the long-term effects? How does the new normal working situation with teleworking, digital meetings influence gender equality? Have the challenges facing transport administrations to attract female employees changed, maybe due to COVID-19? And how, if they do? And which new strategies can transport administrations adopt to face these challenges? Could these questions be relevant to seek answer to in our work? Are we missing something? Are there other questions more relevant to the organization of staff in transport administrations? And I hope we can get back to some of these questions during the webinar. Thank you very much.
Thank you very much, Anna. And to allow people to provide input and answer your ask and your question, people can put in the chat box directly to you some responses maybe. Your emails are here at the end, and so obviously they can send you an email, and I'll be reminding everybody and asking that question again of everybody as the webinar goes on. Thank you, Anna. Yeah, so I'd like to call on Professor Gina Porter, if I may, from the Department of Anthropology at the Durham University. Gina is a geographer and has undertaken a substantial amount of ethnographic research around mobility and its spatial aspects for many years. Has been mostly focused on mobility in Africa. She's recently led a 3-country study on youth and mobile phones in Ghana, Malawi and South Africa, and is now leading a study which she'll tell us more about on youth engagement and skills acquisition in Africa's transport sector. Gina, please. Thank you.
Hi, thank you, and good afternoon, everybody. Yeah, just to reiterate what everybody's been saying, of course, transport is really crucial for women, for their lives, for their well-being. And I'm just going to show, go through a few slides fairly quickly at the start before I get to the point where we're looking at the impacts of COVID-19. So if we go to the next slide, please. Yeah, our research, we're in the midst of this project looking at how young women living in urban peripheries go on in terms of using transport and in the transport sector as workers. And it's very much a collaborative piece of research. There are over 30 researchers involved, and we've got 18 community peer researchers who we trained at the outset. It's funded by the ESRC, the UK ESRC GCRF programme, and there's a lot of information if you go to our website. So I'm just going to go on, yes, to show you the 3 cities, Cape Town, Abuja and Tunis. But we got to the middle of March 2020, suddenly we found in Durham we weren't allowed to travel out, and suddenly there was lockdown all over the place, and we had to think what we were going to do and how we would reshape our current study. So yeah, if we go to the next, when we got to this point in mid-March, we'd already gathered quite a lot of data. We were in the midst of analysis and preparing for some pilot interventions with TransAid. But some general points: patriarchal culture, really across these low-income areas in these cities, very limited transport availability within these very poor areas. Essentially, a transport sector that's dominated by men. Women just generally get work in the lowest paid areas, porterage, carrying stuff, ticket sellers, cleaners, some taxi drivers and mechanics, but few and far between. And essentially, the whole travel atmosphere is shaped by men. When women get on a vehicle, they maybe find they're pushed, they get stuff stolen, they face verbal and sexual harassment on the vehicle, also at various stations and so on. And in their own neighborhoods at night, it's very difficult to find a taxi or vehicle of any sort, and just walking is dangerous. And you have to just really essentially walk in a group if you want to stay safe. Next, please. So we're at this stage. We've got to reshape our current research at the moment because we've got that stop. Our planned intervention work's on hold. We're reviewing what's happening online, locally in our cities. Some of our researchers are preparing blogs, writing personal reports, and that's in progress. But we do have ethical concerns, really, that we can't put too much pressure on so many already overstretched women keep asking for information. It's a difficult point in time, but we do identify a whole series of areas where we're going to need to start to look and see what's going on and to think about the future. So there are a whole series of questions I've put up here, but I'm going to focus principally in the next few slides on looking at how COVID-19 is impacting on women as transport users and as transport workers, and the whole impact on women's well-being. Next slide, please. So we've got diverse city context, but we've already found common themes in the way women experience the transport sector in those low-income, high-density areas. And in lockdown, we're seeing increased gender-based violence, which is unsurprising in a sense when you've got families living in very close circumstances in very small congested areas. women having to go out still to find food, to find water, to get healthcare and so on. But at the same time worried about whether they're going to be stopped by the police, they're going to be in trouble. And so much concern really to what to do. And then the mobile phone really very much part of practical and emotional support, it would seem. Next, please. So if we look, for instance, at food and water supply and how women go on, they're the main household provisioners in all these cities. Food is difficult because in the first place, it's coming in more slowly into urban areas from agricultural areas. Women have got to find where it's being sold and so go and source it. And very often they're going to have to travel further to find where there's a good supply. And water, again, if you don't have pipe-borne water, you've got to queue for water. You get lots of people around the public taps. And of course, if you've not got much water, increased disease risk. Generally, livelihood outside the transport sector as such, a lot of women essentially in the informal sector, petty trade, particularly around taxi ranks, for instance, and bus terminals in Cape Town. In many places, women not able to get to sell are being moved on by the police, so possibly even more hawking than normal. Really, because they've got to still find an income very often, walking long distances. And of course, there is all the emotional and economic stress of the whole thing. So for Cape Town, for instance, it's a very unequal city at the best of times, but now women are really facing massive stress. They have always been very careful planning routes to work, routes to the shops and so on. But now fear has increased. You've got to go even earlier in the morning to avoid the food queues if you want to get food. But then you're even more exposed to potential attack. Women are really keen to stay safe. They are wearing masks more than men on public transport. And they're keen to keep to the rules. But when you get on the Amapela, those informal taxis that work in the townships, then you find that the drivers are often ignoring the 70% passenger rule. And women are really worried to say anything. It's not easy. When we were working early on in Tunis, people were starting to say, sexual harassment is a massive issue, but for now the virus is even more of an issue. Fortuitously, since that time, the public transport was made free for men and women in Tunis, and that has been very beneficial, I suppose, for women who need to get and have approval to travel, because if with lower densities on buses, presumably less sexual harassment. Who knows? We don't know. Within the transport sector as well, it's difficult. We said, yeah, women in low-paid, insecure jobs, more job insecurity now. But at the same time, you've still got to do all those other jobs at home as well as whatever work you're doing if you've still got your job. And at the same time, you're worried about what disease you might, whether you will pick up COVID-19. And for women who are running taxis and so on, all the issues around social distancing, bribing police and so on that might happen. In Cape Town, in the townships, a lot of women who are doing transport go for school transport driving because it's a good business and people like women to do this sort of work for their children, but no schools open. When will the schools resume? A bus conductor talking to one of our RAs as well, then saying, you know, she's an essential worker. She's got to go to work. She needs the money, but she's really afraid. So overall, if we think of the post-COVID scenarios that we're getting in low-income neighbourhoods, it's a very tough time for women. And how is it going to go forward in the future? Is it going to get worse? It will need very careful work to ensure that women's situation doesn't get worse as informal transport sector job security likely declines. Maybe there's better opportunities going to stay in the formal sector, but overall, I think we can see that it's going to need a lot of effort to grow women's participation. A lot of thought needs to go into this. And just to say at the end, our research team, with over 30 odd people involved in this project. Fatima is going to talk next about Nigeria, but our young women community peer researchers were absolutely crucial. They are very much at the center of our work. And yes, very much appreciate what they've done. Thanks. And thank you.
Thank you very much, Gina, for that cross-continental and very rich data, very rich evidence sort of that you're describing. Thank you. Yes, Fatima, Dr. Fatima Adamu is our next presenter. She's a sociologist at the Usman Danfodio University in Sokoto in northern Nigeria, as well as an activist, and her entire work in research, teaching, training, publication and activism is centered on women's empowerment and gender transformation. Yep, her expertise centered on gender and equity research analysis. African feminism and women's movements, been doing this for a very long time. So yes, Fatima, please, the sort of picture from a Nigerian perspective.
Thank you very much. Next. Yeah, this is, yeah, no, go back there. This is part of the study that Gina just presented to you. And it's an attempt to really to make a gender analysis of the measures government took in order to regulate the transport sector and its implication for women. And we're drawing from the findings we've made and the continuous research we've done as pointed out by Gina. Next. So the key findings, and I'm not going to, we look at, as Gina said, the role of women in the transport sector, both as users, as workers, as well as those that are employers. So there are some that are employers in the transport sector in Nigeria. That is some who will buy some tricycle, motorcycle, and give it on hire for people to run and they make business. So we look at all the three angles. And one of the few challenges they pointed out was the issue of the security, the safety and the security. And this is both for users of the bus services, the taxi and the tricycle and the bicycle. And they all talk about insecurity, both in the vehicle or in the transport mode, as well as in the terminal and the bus station. They also talk a lot about discrimination, that women are really discriminated against, and this is both as users as well as workers in the transport sector. They all talk about challenges, those that are, you know, African women were known for our entrepreneurship and trading activities. They really complain about the challenges they are facing transporting their goods and services to and from the market. So a lot of the challenges they mention, we ask women, generally, everybody will tell you, oh, everything is in the hand of God. We pray before we leave the house and going and coming back. And so is the prayer. So I just have some few quotes here to give you a feel of what they are saying. So one woman said, look, my daughter went to University of Abuja and she was robbed and stabbed on the neck in a taxi on her way back. The men in the taxi collected her money. I have to remove her from the university for my own peace of mind. The girl was denied access to education because of that. And another one said, look, they charge us more than, another user said, look, they charge us more than they charge the men. And also the women who are drivers, when they come for loading, we call it, they want to take passengers. They will always tell the taxi women, no, let us give passengers to the men first. And so they said they have to fight back. And so they encourage, they encounter all sorts of challenges. And for many of them, those who are involved in the business of transporting goods and services, they say, look, you know the problem as women. We have babies at the back. We have to carry load. So women are really suffering. So these are some of all the challenges they are facing in doing that. So next. So in view of all of this, as we all know, it's across the country. Many Nigerian government, the Nigerian government, both federal and state, have come up with the guidelines on transport sector for the transport operators. And those guidelines clearly is to maintain the social distance, and so they can't take they have to take 50 to 60% of their capacity. They have to provide all the necessary PPE protective gears needed, the gloves, the mask, the washing of hands, the sanitizers, and all of that. So these are the requirements for the transport users. No more overload, and Nigerian vehicles, public vehicles are notorious for overload. No more overload, and so many, and operating times should begin 8 a.m. to 4 p.m. So there are all those. So the first time in the history of road transport system in the country, the government is making an attempt to regulate it. And all along before the COVID, it has all been handed over to the unions. The unions are so powerful in the road transport sector, and the government is now making an attempt to regulate it. So we're trying to make a gender analysis of all of this effort by government, and to see how is women doing under COVID-19. So we look at one issue is definitely is those engaged in the transport. Many women complain that, you know what, the fact that we are now under lockdown, both the husband and the wife are not able to go anywhere. Before that, for us, we did not make any contingency plan. But for the men, they were able to continue their business despite the lockdown. But for us, we could not. And again, that was used as an excuse there for the little capital they have. Since you're not doing anything, why can't you then use it for the family? So many of them are already crying that they have lost their capital because they have to invest in the family, give food to the family. Another issue is the issue of course, the disproportionate share of household expenditure, as I've said, by men. And one woman said, you know what, we need food. You know, children do not know the meaning of hunger. And when they are hungry, they do not go to the father, they come to the mother. So we have to put our money in it. And another woman said, you know what, the lockdown has really tested our management skills as women. We have to know how to manage the little resource we have, and it's really tough. So the same thing with household burden. Women said, look, men are now looking for, they are always available now in the house, and so they want more food, as if now the family wants food. So they are always cooking. So the women and the girls are always in the kitchen, we need this, we need this. And the same thing with the issue of homeschooling, that is also the burden is shifted on to the woman. Next. So what is another interesting thing which came out for me clearly, which I found amazing, was the way in which some of the women who are really from poor family and their husbands were all working in Lagos in the southern part of the country, and they normally send them money, not through the bank, but they send it through the transport union. So now for the past 2 months, they could not get the money because there is no more movement of vehicle passengers. So they could not get their money back. And that has been a very serious problem for the families. In fact, the committee team that is handling that problem in Sokoto, my hometown, said, look, they have to even refer one woman to a psychiatric hospital because she was really disturbed. They did not hear from their husband for 3 to 2 months, and there's no money to cater for the family, and they don't know what to do. And that is really a serious issue. So transport, I never look at it as a form of banking, financial transaction. And that came out only with the COVID-19. Next. Next. So another big challenge, the gender, back again. The challenge is the gender-based violence. That is in my own town, about the cases. It has increased over the years, over the months. And next, so what is the future for women? It's obvious that women they play a critical role and they are being discriminated. And the effort of the government for the first time to regulate the health sector. And we're discussing with some of the women in the transport sector. And they're all saying, look, we really want these rules to continue. They want the government to set up the rules and regulations, and so that then women can really position themselves in the sector. And this is an opportunity, therefore, to have another normal, to have a new normal for the women in the transport sector. Next. And so we believe, and they believe, that by having those, sustaining the rules and regulation, the effort by the government to regulate will really reduce the extortion and the discrimination they are facing, the arbitrarily unregulated prices they are giving to women, the issue of the insecurity they have, that will be. And importantly, that will provide support to the women in the transport business, and as part of this project, we are doing in the 3 countries, we have small component that talk about action research, and it's one of the things to how can we support women in the transport business, those that are employers in the transport business, to formalize themselves, to form a pressure group in such a way that they are never left behind. What we want, therefore, is we want to integrate women in the rebirth and research of the Nigerian road transport sector. We don't want to go back to the old way of doing things. We want a new normal that integrates women in the transport sector. Thank you.
Thank you, Fatima, for that call for future action and future direction. Thank you very much for that. And the rich material you gave. So I'd like now, so we've had 2 presentations looking at the impact on mobility, women's mobility, everyday travel on COVID-19. I'd now like to move to women as workers in the transport sector, and I'd like to ask Clarke, who's Deputy Women and Transport Workers and Gender Equality Officer at the International Transport Workers Federation. She leads on the gender work within the International Transport Federation's Our Public Transport Priority Programme, and she has worked there at ITF for 20 years and played a leading role in the first ever International Transport Workers Federation Action Forum on Violence Against Women in Public Transport back in 2016. So Claire, please.
Thank you, Jeff. Good day, everyone, and thank you for this opportunity to talk about the impact of COVID-19 for women public transport workers and the key areas for action that the ITF has identified as part of the immediate and longer term response. As Jeff said, I'm the Deputy Women's Officer at the International Transport Workers Federation, the ITF, which is a global federation of 670 trade unions representing 18 million men and women in all transport sectors. The current crisis has brought into sharp focus the critical role public transport services play in the economic and social life of cities. And for women, transport continues to play an important role. So, for example, statistically, a greater percentage of women rely on public transport to go to work, to access services, and to undertake caring responsibilities. And public transport workers are indispensable in dealing with this emergency and keeping public transport systems moving. And as we can see from the quote on this slide and the next couple of slides, women are proudly a key part of the transport workforce that is vital to successfully responding to the challenge of COVID-19. They are the drivers, the ticket sellers and conductors, and they are also the less visible workers, keeping transport systems running through critical work such as maintenance, security, cleaning, and administration. And women are especially concentrated in these areas. Next slide, please. So whilst all transport workers are being severely impacted by the crisis, we know that the gender segregated nature of our industry will mean that there are specific and additional impacts for women transport workers. And there is scope for the challenges arising out of this crisis to put an additional strain on existing inequalities. And this is something that has been acknowledged by the ILO, the International Labour Organization. So, for example, women are concentrated in customer-facing roles with increased vulnerability to catching and spreading the virus, including because of a lack of adequate and appropriate PPE. Cleaners on transport systems also face an increased vulnerability to exposure to the virus, and in many cases this work is subcontracted. So workers may be excluded from the benefit of higher standards of direct government or lead company protection of pay, terms and conditions, and they may also have difficulty getting the appropriate PPE. Overrepresentation of women in precarious and informal work means they are more vulnerable to layoffs and or cuts in working hours and loss of earnings without proper social protection and or compensation. And in some cases, informal transport workers have no choice but to continue to work in order to earn a daily wage, despite the risk to their health or repercussions from the authorities. And in many countries, migrant women transport workers have no work in lockdown situations. And there are other aspects of the crisis that women will face specifically or disproportionately, not exclusively, including maternity concerns and risks, protections for pregnant workers, access to reproductive health services and maternal care services, and a disproportionate share of unpaid care responsibilities. As a woman train guard in Italy stated, women railway workers are torn between the importance of our job and our fear of spreading the virus to our families. So it's therefore imperative that the global narrative and response does not exclude women transport workers, as is so often the case. And ILO recommendation 205 demands a gender perspective in all crisis response and design and implementation, gender inclusive social dialogue, and gender equality and the empowerment of women and girls for enabling recovery. And at the ITF, we have identified key areas for action by employers, governments, and investors in relation to COVID-19 and women transport workers, which must be negotiated with unions and with women's participation. And these areas for action, which include employment and financial protections, leave provisions, and additional health and safety considerations for all women transport workers, regardless of contractual status, are based on some key themes that I'm going to outline briefly now. Next slide, please. So, an example where a gender responsive strategy is vital are the health and safety measures that are implemented in response to COVID-19, and in particular in relation to the provision of PPE and sanitation. Public transport workers must be adequately protected to enable them to carry out their critical work. And this means adequate provision of PPE and working conditions that minimize transmission and facilitate social distancing in accordance with the ITF Global Charter of Demands to keep public transport workers safe from COVID-19, and which you can see there on the screen. And for women public transport workers, this means ensuring measures are gender appropriate. So in other words, making sure that PPE is made for women's bodies. Next slide, please. Also critical to the response to COVID-19 is safe access to hygiene, water and sanitation facilities, which is already a major issue for transport workers with specific impacts for women transport workers. And there needs to be safe access to appropriate sanitation facilities and breaks, particularly given the shutdown of many public spaces often used by transport workers. And strict and regular cleaning and sanitation procedures must be followed in transport workplaces in accordance with the provisions of the ITF guidance on COVID-19 and access to sanitation facilities for transport workers. And this process must be inclusive and take account of transport workers, both women and men, transport workers' specific needs, such as menstruation, pregnancy, disability, menopause, and pre-existing health conditions. And then in a more isolated environment than before, women may find themselves at increased risk of violence at work. In particular, workers in customer-facing roles may be facing increased risk of violence from members of the public who are coping with intensified emotions. Scarcity of work could also amplify existing risk of sexual coercion, particularly for informal workers. And isolation and curfews will further impact women transport workers experiencing domestic violence, as will the economic impact of reduced survivor support and initiatives. And we cannot ignore the global increases of domestic violence. Domestic violence is always underreported, but even so, in Hubei, China, there's been a tripling of reports of intimate partner violence. In Brazil, a 40 to 50% increase. In Vancouver, Canada, calls to a domestic violence hotline rose over 300%, with 40% of callers reaching out for the first time. In Turkey, the month of March saw the deaths of 29 women by men, and of these, 21 women were killed in the 20-day period from the 11th of March when the government issued its stay-at-home order. So safety measures are therefore even more critical, including provision of meaningful and relevant support for survivors of domestic violence and provision of safe commuting measures for transport workers to and from work. And we also need to lobby our governments to urgently ratify and effectively implement ILO Violence and Harassment Convention number 190. Fundamentally, we need to make sure that our strategies are gender responsive, recognizing the extent to which the outbreak affects women and men differently is a fundamental step to creating effective, equitable policies and interventions as part of a strong response to the crisis, which will result in better outcomes for women, but also for everyone. And a critical part of this is gender disaggregated data, so that we obtain the essential information to help inform our strategies and measures. And there should be gender impact assessments and gender responsive planning enforced by due diligence, including through projects and loan programs in response to the crisis. Representation of women and their trade unions in decision making is critical to ensure that strategies are gender responsive. And the evidence is overwhelming. When women are not represented, the issues that impact them specifically or disproportionately are not addressed. And with low levels of women's representation in industry decision-making bodies, there's also cause for concern about the long-term impact on women's participation in the industry. And as we emerge on the other side of this crisis and the transport industry adapts to the new reality, we need to make sure that existing women's rights are reinforced and that changes do not build on existing inequalities. This also includes any new technological developments that have been introduced temporarily as part of the response to COVID-19, or that may be expedited during the crisis. So after COVID-19, we cannot go back to normal. For many women transport workers, this means being overrepresented in precarious jobs with no income protection and health risks, being underrepresented in decision-making and leadership positions, facing violence at work, and wearing nappies for 12 hours at work because of unavailability of toilets. This is not normal. And instead, we have an opportunity to ensure that transport is organised to meet social and economic priorities, including the provision of good jobs for women and men transport workers. In public transport, the ITF and the Global Employers Organisation, UITP, signed a joint agreement in March 2019 on strengthening women's employment and equal opportunities in urban public transport. And this is a good foundation to achieving a gender equal new normal. Thank you.
Thank you, Claire, for that call for action, but also that highlighting of the hugely key, important and invisible role women frequently play in the transport sector under normal times, but also under the emergency. Thanks very much for that. Naomi is our next speaker. Naomi Mwaura is the founder of the excellent Flone Initiative, which is a Pan-African women-led non-profit organisation, NGO based in Kenya, working to the realisation of safe, accessible, inclusive and sustainable public transport with particular focus on women and vulnerable girls, with a view to realising an equitable and socially just transport system in Africa, and also the organisers of the excellent Women and Transport conferences that are now becoming an annual feature in East Africa. So Naomi, please, the picture from Kenya in that respect.
Hi everybody. We are just 5 months into 2020 and what a year it's been. Ooh. Oh, can you hear me? Sorry.
Yes, Naomi, we can hear you loud and clear. Go ahead.
Oh. Yeah, so I'd like to express my heartfelt thanks for each of you for making time to join this webinar, and thank IMC staff for putting this together. As Jeff mentioned, my name is Naomi Mwaura. I run a nonprofit organization called Flone Initiative in Kenya. And Jeff, thank you for that introduction. So in this webinar, I'm going to focus on one of our 4 programs, which is the Women in Transport program. And for the past 2 years, Flone has been establishing Women in Transport chapters in Nairobi and Mombasa. And we hope to attract, retain, and advance women professionals working in the public transport industry in Kenya. So in Kenya, the Ministry of Health confirmed the first case of coronavirus on 12th March. And as a result, the government announced various measures targeted at public transport in order to prevent the further spread of the virus. And to this end, we conducted a random sampling of about, yes, next slide, of 30 out of the 70 women who are our Women in Transport members. And we wanted to establish how they've been affected by COVID-19 and the measures the government has put in place. So in this presentation, I'll take you through the survey findings. So we interviewed women, previous slide, sorry. Yes, so the women we interviewed are drivers, conductors, booking clerks, and a mechanic working in the public transport. And we found out that they all had an average family size of 3, but 83 of them stated that they were sole breadwinners or single parents. And as a result of COVID-19, they reported loss of jobs, with about 53 of them stating that they were no longer in employment. Next slide. Yeah, and they were on forced unpaid leave since the owners of the public service vehicles had decided to close down. And this is because it didn't make economic sense for the owners to be operational, especially with the government directive to maintain the carrying capacity to 60%, but at the same time expected to pay the insurance and county fees, which are actually daily. And so right now, the women who are on forced unpaid leave rely on the goodwill of their former colleagues for short-term jobs, which could involve, for example, calling commuters into the vehicles or sitting inside the vehicle to act like it's full so you can get more commuters to come into the vehicle. And in such cases, if they're lucky to get such a job, they were taking home around 100 to 200 Kenyan shillings, which is about $1 to $2 per day. But if they were in their former jobs, they would normally go home with about 600 to 1,000 Kenyan shillings, which is about $6 to $12 per day. They also reported the issue of sexual exploitation, where the women stated that in some cases, men were taking advantage of the situation and asking for sexual favors in return for giving them these short-term jobs. There was also the fear of contracting COVID-19, where they definitely felt they would be safer if they stayed indoors, but especially since their job entails interacting with customers and handling money. However, this is not an option available to them since they are relying on the money they make daily to buy food supplies. And whereas sanitation measures have been put in place in most of the vehicles, most passengers are reluctant to use the sanitizers, citing that they are most likely fake. And this is because there are so many sanitizers in the market and no one can distinguish the genuine ones from the fake ones. And as Claire mentioned, the women are also concerned about contracting the virus and most importantly, passing it on to their family members. There was another issue that came up, which is the presence of children at home. So given the long working hours, so on average, the women work about 14 hours a day. And so most of them had decided to take their children to boarding school. But then the government decided to close all schools, and so the kids are back at home. And this has put a strain on the food resources and the caregiving responsibilities. And the women stated that they now have to leave their children at their neighbors' houses, which is an arrangement they're not quite comfortable with, but they don't have any other option since they have to go out and look for work. Additionally, there is an extra burden on them to purchase data bundles for internet access, since, again, the government directive was that school should continue, learning should continue, and the learning materials are currently being sent via WhatsApp by the school administration. This means that when they get back from work, if they get any work, they have to spare time to assist the children with their studies, administer and assess examination. And as a result of this, some of them have sent their children up country to live with their relatives in order to ease the pressure. Next slide. So fortunately, all the women interviewed were physically healthy. None of them had contracted COVID. But they were not in a good mental state good mental and emotional state. So they reported general anxiety, lack of clarity of thought, and frequent headaches. Next slide. There is also the issue of now food has become expensive because the supply chain has been disrupted. And 97% of the women cited lack of food as the main concern. Also, landlords still expect rent to be paid by the due date, but then, as I mentioned, most of the ladies are already out of a job. And 30% of the women had already defaulted on rent by the time we were doing the survey. There was a general fear of police brutality after the curfew. So in Kenya, the curfew has been imposed. The curfew starts at 7 p.m. Right. So the women are supposed to make sure everybody, or public transport operators are supposed to make sure everybody who doesn't have a private car gets home before 7 p.m. But how do they get home? How do they themselves get home before 7 p.m.? And we've had issues of people being killed after being caught in a curfew. The other day, there was a lady who was running away from the police. He'd decided to hide in a river, and she got carried away by the river and drowned. So there's just a very huge fear of being caught outside during curfew hours. Next slide. So based on this survey, as I mentioned, we have a Women in Transport chapter in Nairobi and Mombasa. So we have, to ensure the program sustainability, we have elected officials who we work with to run the chapters. We hope they'll be independent. Well, we're hoping they'll be independent by end of this year. And so we met with the elected officials, and we developed the wish list, as you can see from your screen. And we hope to support 30 women. We've given priority to 11 households of households led by women who are currently unemployed and with dependents. And we hope to provide a weekly stipend of about 1,000 to 2,000 Kenya shillings, which is about $10 to $20 per household. And unlike most interventions where they actually take foodstuffs, we decided that we will trust the women to know how best to use the stipend and how best to address their individual family needs. And so we are just giving financial support, and then we'll follow up later to just check how the money was spent. I'll talk about this in the next slide. We also would like to develop and disseminate an online campaign just talking about the challenges and the interventions that we should implement for women professionals working in the industry. Lastly is to provide safety gear. As I mentioned, there's a lot of masks and sanitizers going around, and there's no approved standard yet of what's the best mask or what's the best sanitizer to use and for what purpose. And so we hope to provide the appropriate safety gear for the women, and especially those who are employed. Thank you. And then, so now the way forward is that we are now currently working on a policy brief in partnership with the Socially Just Public Transport Working Group, which is hosted by the Frederick Ebert Stetson-Fug Kenya office, which is FES Kenya office. I hope I pronounced it well. And just this week, we started sending out weekly stipends to 20 women in transport households. So we sent a stipend of about 2,000 Kenya shillings, which is $2. And be on the lookout on our social media pages. We will be providing data on how the money was spent. You can follow us on social media, just Flone Initiative on Twitter, Facebook, and Instagram to have a look at that data. In addition, we will be exploring how we can use technology to mitigate the impact of COVID specific to the public transport and mapping out post-COVID interventions. Next slide. So that marks the end of my presentation. Thank you for your time and looking forward to answering any questions.
Thank you, Naomi. That's absolutely fascinating. Thank you very much for that. And some really interesting things that you're actually trying to put on the ground that will be interesting to see how they work and the scope which they can be scaled up and shared quite widely, I think. So thank you very much for all our presenters. This is just before Louise looks at some of the questions and the discussions that's coming in. I just wanted to raise a couple of things. One is to remind everybody of Anna's ask to the audience of feedback to the questions that her working group are thinking about, whether these are relevant, whether those are asking the right questions. Please either put that in the chat box directly to her, or you have her email address on the slides. And I just wanted to raise one quick clarification question that Maggie Heritage raised with Naomi's slides, if I may, Naomi. You mentioned family sizes of 3. Could you just explain what that's composed of? Is that mother, father, and child, or 3 children, or what's the figure on that?
Yes, so that means 3 children. They can either be children or siblings that they are supporting. So it's 3 dependents.
Okay, that's a great clarification. Thank you. And if I could jump in with a starting question, because one we had in an earlier discussion that came in on email a day or so ago, which is this question of the impact of physical distancing on the level of sexual harassment, or the opportunities of sexual harassment on public transport, both formal and informal. The view of the questioner was, maybe now we have bigger physical distance and lots more physical distancing, sexual harassment will somehow disappear. Maybe I could have that to Naomi first, maybe, and then Fatima, even on the Nigeria context. What's your view of whether that's likely to happen, or whether you're seeing that is happening? Naomi, maybe your thoughts first.
You're muted, Naomi. Do you want to unmute?
Oh, sorry. I keep forgetting to unmute myself. Sorry, Jeff, could you repeat the question? I think my internet had gone off.
The question was really, or the view expressed was, that now we are enforcing physical distancing on public transport and people have to sit further apart and lower capacities, that somehow sexual harassment for women on public transport will somehow disappear because everybody's more spaced out. What's your sort of view of whether that's likely to happen or not?
Okay, yeah, really good question. So according to our data, sexual harassment happens in various stages of the commute. It's usually, for example, walking to the stage, at the stage, inside the vehicle, what we call matatus, and when alighting, right? So there's various forms. Right now, your question is targeting about, one specific inside the vehicle, the harassment that happens inside the vehicle, but we also need to look at the various stages of a commute, and if that has reduced, which I highly doubt has not. And so I think we need to be more proactive in reducing forms of harassment and both widen our scope of what harassment is and also where it takes place. So for example, we did a study in Mombasa, which is one of the cities in Kenya, on harassment, and we found out that most of the harassment that happens when the ladies are walking into the bus stop and at the bus stop. So you see, even with COVID, that has not changed. Yeah.
Okay, thank you. Fatima, from a Nigeria perspective, are you seeing evidence of that change, or what's your view on that?
Not much. Most of the harassment, sexual harassment, happens in the bus stop, and it still happens. I mean, they are sick people. I don't think it matters to them whether there is COVID or there is no COVID. They will still make an attempt. I haven't seen. There's no report of that reducing in any way. It's normally either en route to the bus station to get or in the bus stop. and still there is still that fear. The only thing is because there's no longer transportation by night, so that's because that's the most time in the evening that most of the harassment happened. But there is still element of that.
Thanks for that. Louise, other questions?
Yeah, so firstly, Jeff, I just wanted to say thank you to all of our speakers, and based on the comments that are coming through, I think the attendees have really appreciated the information that's been provided through the webinar and through their slides. I've got a question for Gina from Manisha Gupta, who's asking regarding short-term and long-term impact post-COVID as a result of working from home or the new normal on low-volume roads in rural settings in low-income countries. The access to mobility for formal and informal work, education and health services will get harder as a result of the poor frequency of buses, road maintenance, etc., an issue to be addressed. Gina, do you want to comment on, you're muted at the moment, on the short and long-term impact post-COVID for people in low volume rural settings?
Yeah. Yes, absolutely. I think the rural context is obviously, it's always been difficult enough for women finding transport in rural areas. It's going to be harder. Yeah. I think our current work is in cities, so my most up-to-date field material and experience is in cities, but it will be harder in rural areas to regulate, and and there will be less funding available, I would have thought, to improve on current conditions.
Okay, do you want me to move on to the next question, Jeff, or do you want to?
Yeah, sure.
Hello. Okay. So there's a comment from Rita Jacinto saying she's from the Lisbon City Council in Portugal. Do any of the speakers or anyone have any work to share on bus stops to improve the safety of women while waiting for the bus? I don't know if any of our speakers have any innovations from their countries that they can share with Portugal.
Hello? Hello? Hello?
Go ahead.
Hello? Hello, my name is Asita. Thank you for all these brilliant presentations. I have one question regarding Sister Fatima presentations. I would like to have some information about what were the psychological aspects they put in place during the GBV in Sokoto to East Bash.
Thanks for your question. Thank you. And can you mute your mic after that? Thank you. Fatima, some thoughts?
Yeah, actually, the support they are providing, most of the Hizbah, is the Zakat Sharia team. Most of them, they are providing they are providing financial support, drawing the resources from the Zakat. This is Ramadan time, so many people are giving out Zakat. The arms, the Islamic arms. And so they are only providing the financial support. And it's one of when I interviewed the man, it's one of his concerns that they are not able to address the psychological, they don't even know how to reach the husbands, except they were referring one case that became obvious that really needs support, so they are referring her to the psychiatric hospital. But any kind of psychosocial support, Nothing. I don't think there is even the capacity to do that. And this is where some of the CSO, we are going to refer the case, support them to maybe to develop something based on this your question. I never even thought of it, but it's something maybe we should support them to address. I mean, how they can provide the psychological support, or one women's group working with them to provide the psychological support to these women, because they are really very poor women.
Thank you, Fatima.
Okay.
Louise, shall I take another question?
Yeah, so we've got a question from Bruce Thompson, commenting on the fact that there's still many barriers in place and difficulties that women face. He was wondering if the presenters had any examples of solutions that had successfully overcome many of the problems that have been cited here today.
Can I say anything?
Yeah, please go ahead.
Yeah, I think as I've said, which I was rushing, I didn't explain well. We were thinking as part of our research, as I said, we have an action research. One of the things we're considering to implement is really how we can bring the women together into a pressure group, and so that they will be able to be advocating for the kind of the new normal they want in the transport sector. And also for women in the transport business, that's those who are employers in the transport business. We're trying to see how we can bring them together and through them address some of the concern and work with those they are employing, so that they become gender sensitive to some of these issues that women are implemented. This is still something Gina may explain more. This is all ideas still running around within the team, but we're lucky we have that intervention part of the research, and we're really ready to try to address this challenges. Yeah. Gina may add more.
Yeah, shall I add a little?
Please go ahead.
Yeah. Yes, the whole focus of our work is actually to try to not just understand the situation, the difficult situation many women feel as transport users and as employees in the transport sector, but to look at what sort of skills we can help with developing that may improve conditions for the future. And we're working with TransAid. And in each city, the idea is that we are developing a couple of pilot skills programs. Some will be with users, some will be with women who want to work in the transport sector or who want to improve their status in the transport sector. And unfortunately, we're just at the stage of starting to develop some of these intervention efforts, these pilot efforts, when COVID-19 came in. So this is very much still in debate, but frustratingly on hold, because we're working very much with communities. We have our peer researchers, and engaging with them and with our consultative groups, so with the transport organizations, with people in the ministries and so on, to work out what may be useful interventions, but that are specifically relevant to the particular context. Because although there are many general issues that cross-cut all the neighborhoods and the cities, these low-income neighborhoods, there are very specific local conditions that you have got to take into account. And it's that sensitivity to the local as well as to those general issues that it's really quite complex to build appropriate interventions. We want to pilot interventions, see how they work. So we have baseline studies. The idea is to make the intervention and then look at how successful these are, why, if they don't work, why they don't work, if they do, whether there are wider lessons.
Could I just jump in there, Gina, on just to highlight this idea of trials and idea of innovative pilots, as it were. I've been asked by Bernard Abika, the team leader for high volume transport program, to just mention that within the next couple of weeks, the high volume transport will announce an innovation grant call for short research projects and analysis work on COVID-19's impact on the transport sector that will include the impact on women in transport. So that may be an area also we can promote even further, these sort of experiments and innovation, and of what are the solutions going forward. Louise, I'm conscious that we sort of get to the end. Shall we take one more, or how should we?
Yeah, I've got a question for Anna that's come through. Many countries are preparing for their recovery strategies post-COVID, talking about green development. Have you thought about specific strategies for job creation within the transport sector with a job perspective? With a gender perspective.
Interesting question. We are thankful to, or we hope to find these and to share these within the work of Working Group 3 in the coming cycle in the coming PIARC cycle. So I don't have a good answer, but I'm certainly looking forward to collecting some good approaches and strategies for that. And I think everything we have heard today stresses the importance of getting a larger proportion of women in the employment in the transport sector and in transport administrations. And I've also picked up on the importance of commuting and strategies for commuting, and the importance of public transport and the situation there, and also the impacts of COVID-19, of course, on public transport. Very important to look into and examine what we can do to support there. And I also saw an interesting comment on working from home. We think we have to follow the development of and the effects of increased working from home, and what impacts that could have on gender issues.
Thank you. Christos?
Louise, if I may add to this as well, please, and this is Christos, that we are really early on in the new cycle for PIARC, and this is one of the reasons it was so important for Anna and I to be here and participate on this webinar today and hear all of these questions and ideas that they came up. So if people are interested, there is still plenty of opportunity to work with the first delegates of each country for people to be appointed to PIARC for the next cycle, and we will welcome anybody who's interested in working, with us. Of course, given that that they have to be nominated by the first delegate of a country.
Thank you. Jeff, can I impose on you and just ask one last question? And it might be something that each of the delegates or each of the speakers want to comment on. I'm going to roll two questions together. There's a question from Lawrence and from Heather, but they're both along a similar theme, which is going to be, once we get to the position post-COVID and all of this, I assume, is something of a memory for us. We're talking about making new changes within transport sector, but once even that becomes a new normal, is there a chance that things will sort of slip back again? A lot of measures are going to be put in place, but once post-COVID is post-COVID, is there a likelihood that the use of transport could slip back to what we think of now as normal?
Hello.
Hello, Fatima.
Yeah. For me, that is my biggest concern. I just feel if nothing is being done to really advocate and really ensure that some of the regulations put in place by government is working, it might go back to the old way. And so it's up to us in the practice to really come up with an idea of how that can, what can we do to really improve the situation and maintain the little achievement made so far, that it's not back to women, and improve the role women can play in the transport sector. So I'm saying, by saying it is not enough, more action is needed. Thank you.
Shall I continue?
Go for it.
Yeah. I mean, I think it's even more worrying that it will be just go back to the new normal. Obviously, the big worry is that there is further deterioration. And it's going to take really concerted effort, I feel, at this point. And yet it is quite a potentially exciting point, because there is the opportunity to do things at this moment. I think it's a matter of whether we're able to get the support for a real push forward. Because the trouble is that very often things just dissipate. And it's great that there are so many people interested at this point. It's keeping and promoting and pushing forward.
Okay.
Louise, if I may add, and at the fear of, using a cliche, this is where really, mass transport and mass transit need to reinvent itself, during and after COVID-19. And governments really need to keep mass transit in the forefront and make it an investment priority. We know that operating transit in the future is going to be more expensive because of the additional restrictions that they're being imposed and the reduced capacities that physical distancing it's going to impose. So we have to find ways to help mass transit, stay relevant and provide better solutions in the future after COVID-19.
Thank you. I'm aware that we're slightly running over time, so I'm going to hand over to Jeff, I think, to wrap up. Just to remind everybody on the point that Jeff made earlier, HVT is looking at a call for innovative research coming up in a week or so. If you're not already familiar with the Research for Community Access program on low volume roads funded by DFID, it is going to be a joint call with the RECAP team. So if you are in our network, then please look out for that. Jeff, would you like to take over and sum up for us?
Thank you, Louise. Well, yes, summing up from such a rich and comprehensive sort of description across all the presenters, and the depth of material presented is nigh on impossible. But I just wanted to pick up on this the last discussion, which is, I think, how long is that post-COVID period going to be before it arrives for the public transport sector? And I think it's actually going to be considerably longer than we can even begin to imagine at this stage. And I think one of the challenges, and a series of the presenters sort of touched on this, is how, in many cases, how do we ensure that there is transport operators and transport workforce still there, once levels of capacity on public transport can go back to commercially viable levels, and what sort of practical measures can be put in place in terms of actually transferring cash to precarious employed informal sector employees within the transport sector, an awful lot of which are put up, disproportionate number can frequently be women involved in that. And so what are those mechanisms that governments and international community need to come together to actually allow cash to still be there, because this is not a month or 3 months. This is maybe 18 months, 2 years and beyond. And we, for example, we have a minister in the UK that is actively saying it's everybody's civic duty to avoid public transport in the UK at the moment. And so that narrative and that perception will go out and will be there for a long time. So the commercial viability and the economics of transport and the impact that has on women, both as workers, but also as predominant users of public transport, really needs to be thought about, I think. But the issue around formalisation and the involvement of governments that traditionally may not have been that interested in setting regulations and setting formalised processes for public transport and for their transport sectors, a newfound interest in may be one of the the encouraging signs going forward, and the longer they get used to that, the longer they may think that's a new normal. It sounded to me like there were some sort of quite interesting small measures and experiments that perhaps we can all take note from. That I liked the idea of free transport in Tunis that Gina talked about. I liked the idea of trials of cash transfer stipends and things that Naomi was talking about. But the other thought I had was, and it's raised in one of the questions around the need for data. I think one of the messages from today is very much this webinar was really interesting to bring together some evidence and some data on the gender differences, and that needs to be extended and widened, and we need to get a gender disaggregated picture of the impacts of COVID-19 and as a normal. But just finally, the point that Clarke raised of ILO recommendation 205, which is that the recovery, there is a recommendation that quite clearly sets out the message. The recovery needs any emergency actions and emergency recovery needs gender disaggregated data. It needs gender disaggregated impact assessments, gender disaggregated involvement and action plans. I forgot to take the final list, but the planning, the implementation, and the impact of any recovery measures needs to be gender disaggregated as the ILO recommendations set out, and that might be a useful starting point for us going forward. So yeah, a very snapshot, but I would just like very much to say a great thank you to all our speakers, a huge thank you to all of our involved participants, and yeah, hopefully this is a start. Thank you very much.